Hi, I'm Kriti Jolly. I welcome to a conversation with Dr. Radhika Thepetta about COVID-19. She's here to answer some questions about COVID-19, which we probably have in our mind, but we did not know whom to ask. So she'll be here to, you know, clarify a lot of points about COVID. And Dr. Radhika Thepetta is a well-known doctor in Bangalore with over 20 years of experience in US and India. And currently she works with Columbia Asia Hospital in Bangalore. So welcome, Dr. Thepetta. Would you like to tell us a little bit more about yourself?
Thank you, Jolly. Please call me Radhika. So I moved to India about 18 years back. And after I moved, I had the pleasure of volunteering at Satya Sai General Hospital. And now I'm in the grind at Corporate Hospital, which is right next door to where I live. And typically we would be very busy with seeing influenza and dengue cases. And now we are inundated with patients with fevers, and it's up to us to figure out if it's a COVID or non-COVID. So it's a pleasure to be talking with you about the regular do's and don'ts about COVID, what to expect, and what to do, what not to do.
Thanks for being here, Radhika. And so we'll start with some very basic thing, which all of us probably have in our mind. How do we clean the groceries? When we bring it home, we are not sure how to wash the vegetables or the packages or the fruits. And always this thought is in the mind, have I washed enough? Is it safe enough to eat? So what is your suggestion? How do we clean them?
It's a very practical question. We face it every day, so we need to know more. Now, COVID-19 doesn't appear to be transmitted by eating food contaminated with the virus. So we are good there. But as soon as you finish your grocery store run, it's very important that as soon as you come back, you wash your hands thoroughly with soap and water or with an alcohol-based sanitizer. And once you come into the house, the fruits and vegetables, you can clean them as you usually do under running water, or if you are used to using baking soda to get rid of the pesticides, you can do that also. And when you refrigerate them, freezing does not get rid of the virus. So you need to clean the fruits and vegetables before you put them in the refrigerator. And if the packaged groceries, it has to be cleaned with a disinfectant, because we know that the COVID virus can last for about 3 days on hard surfaces and on plastic. So either you clean the plastic bags with the disinfectant, or you just put them aside for about 3 to 5 days before you start using them. And very important, the bags that you used for the groceries, they also have to be either sprayed with a disinfectant, or you wipe with a rag sprayed with disinfectant, or if it's cloth bag, you can just run it through a washing machine and a dryer.
Okay, so you don't really need to wash it with soap. Like some people recommend, wash as much, whatever possible with soap, you try and wash it with soap. So that's not necessary.
Right. So yes, not according to WHO and the CDC, it's not really recommended that you wash with soap.
That's right. So like if they're green leafy vegetables, we just wash it in the running water, they're safe.
That's right. So it's cleaning, not disinfecting, that we want to do with our fruits and vegetables.
Okay. So how long do you think virus would survive on the surface of vegetables?
It's not very clear.
If we don't clean it, let's say.
Right. We don't have specific data. So we only know that on hard surfaces, it can last for about 3 days. On cardboard, it can last about 24 hours. On newspaper, about 24 hours. So if you want to pick up your mail, we tell people to leave them out for 24 hours and bring it in, and so with the newspaper. So fruits, yes. You can.
Okay, what about
so if you want?
Sorry.
If you want to be very careful, so fruits you can clean with soapy water.
Okay. And what about microwaving? If you microwave certain things, you think that's going to kill the virus?
Heat is known to destroy the virus,
Mm-hmm.
but you need to reach a temperature of about at least 56 degrees. And also the length of heat also matters. You need to maintain the temperature for about 15 minutes, which is not practical. And also we know that microwave does not uniformly heat up the food. So if at all you want to use heating as a way of, clearing off the viruses from your food, putting it in the oven is better than a microwave.
Okay. Okay. So that clarifies a lot. Yes, and baking soda also kills virus.
Baking soda is usually used to get rid of the pesticide. It's not a disinfectant. Disinfectant, either it's a soap and water or an alcohol-based sanitizer.
Okay. Sounds good. Okay. Another thought which some of us have in our minds is it safe to order food from outside? From restaurants, takeaways. What is your recommendation?
So since these days the restaurants are offering no contact food delivery, which is a good option. You can do a no contact food delivery. But as soon as you get the food, bring the food inside. Very important to do thorough hand washing and transfer the food into a clean dish and get rid of the containers that are used for delivery. And then you have to clean and disinfect any surface the that had the takeout containers on them. And then again wash your hands.
Right. So washing hands is always the key.
That's right.
Okay, so there is another thought, in spite of all the precautions and whatever care we are taking, what if we still get some symptoms which seem like coronavirus? So what should one do in that situation? Do we need to go to the hospital or just stay at home?
Right. If you have fever, cough, cold, body aches, and feeling tired, the, the initial step you need to take is separate out from the rest of the family. You can wear a face mask, you can stay in a different room, especially a separate bathroom if possible. Take simple measures like taking Dolo or paracetamol for fever or pain, and continue with all the preventive measures like diligent hand washing, avoiding touching the face, and maintaining respiratory hygiene, and cleaning and disinfecting objects and surfaces that are frequently touched. If your if your fever or other symptoms are persistent, you can reach out to your doctor through a telemedicine consultation or go to the nearest fever clinic. But if you have persistent difficulty breathing or chest pressure or chest pain and confusion or severe dizziness and irritability, you need to go to the nearest hospital. And also, if you are from a COVID hotspot or a COVID containment area and you develop symptoms, you need to reach out to the hospital. And also, if you had a contact with a COVID positive case in the last 14 days, you need to reach out to the hospital.
Okay, so what if you happen to go to the hospital, they will test you, and let's say you turn out to be positive, then what happens?
Once you go to the hospital, in addition to COVID, we look at the other possibilities. Is it influenza? Is it dengue? Is it typhoid? Or is it something else? If the suspicion is high for COVID, we refer you to a center where it's tested. And even if your test is negative, if clinically the suspicion is high that it could be COVID, we ask you to self-quarantine at home for the next 14 days if your symptoms are mild. But if you develop moderate symptoms like persistent breathlessness or chest discomfort, then we will have to admit you and treat you as needed.
Right. Yeah. Most of the people have this fear, that if you go to the hospital, you'll be, taken away, quarantined, and you won't get to meet your family and till you get okay. So So how does it work? That let's say if you happen to be quarantined, you need to go to the hospital and you have COVID confirmed. So in that case, what you have to go to a government hospital, or you can go to a hospital of your choice? How does it work?
The government has assigned COVID designated hospitals. You need to go to those hospitals, and once you test positive, you need to stay there until you have symptomatic improvement, or you have 2 consecutive negative COVID tests over a span of 24 hours. Until then, you cannot get in touch with your family. You can only talk with them.
Okay. And who pays for the treatment?
Of course, if it's a government hospital, I'm not very sure, but I'm assuming it's free. But if it's a private hospital, of course, you have to pay, but I'm not sure.
Okay. Okay, I think one final question. Let's say once the lockdown opens up, can we go back to being normal? Can we go out? Can we go to restaurants, shopping, things like that? What do you say?
To keep the number of infections under control, it is very important that we continue with the social distancing as much as possible. And we should continue all the preventive measures that we're doing right now, including wearing masks in the public and hand washing, not touching the face, disinfecting high contact surfaces. And in addition, the government and healthcare workers will continue their efforts, which is testing as needed, quarantining, and contact tracing. But in spite of all these efforts, scientists are still expecting that the virus can persist in the community for a very, very long time. So we need to be continuing with all these measures for a long time. And also the scientists are expecting a second wave of infection, more so in the next winter. So we need to maintain constant vigilance over the next 1 to 2 years, or until at least 80% of the population is immunized when the vaccine comes out, which also can take about 1 to 2 years. So at least if 80% of the population is immunized, because this virus is highly infectious, we will take as many positive cases or immunized cases to develop herd immunity in the population.
Mm-hmm. So we have a long way to go. And
we have a long way to go.
Yeah, and I think the lessons that we all have learned about how to, maintain social distance, hygiene, have to be, become a part of our daily habit. And I feel more importantly, I think we should not forget some very important lessons that humanity has learned as such, to care for the environment, care for your near dear ones, and,
yes.
Be minimalistic, only use what you need.
That's
I guess
so right.
This has been a big learning for humanity on a whole.
Right. This has to become our new normal for the next few years to come. And this has taught us how to respect Mother Nature and not abuse Mother Nature.
So thank you so much, Radhika, and it was really wonderful talking to you. Thanks for taking time out to answer some basic questions. Thank you.
Thank you, Jolly. Thank you for the opportunity. It has been a pleasure.